Hi guys, this is Dr. Shamima Sattar from the YouTube channel Doctor to Help. Today is April 17 and we are going to talk about J&J vaccine, side effect, pause in administration in relation to the blood clots. As you know, both CDC and FDA has called for a pause for administration of the J&J vaccine. I know a lot of naysayers will say, see, I told you. And there are also a lot of people who are saying this is a life-saving vaccine and you are keeping it from the public. Yes, that is true, but think about this. As a healthcare provider, we took an oath, do no harm. So we also have a responsibility towards our population to give them a reason why this happened, what we should do about it, and how we are going to treat these patients. As you know, 6 women were found to have blood clots after the J&J vaccine. The incident occurred between day 6 to day 13. The age population was seen to be 18 to 48. So it's the common reproductive age. And it all happened in women. Same thing happened with AstraZeneca in UK. It was seen that it occurred more in women. And it was paused for a while. Afterwards, it was thought that the benefit definitely outweighs the risk and it was started again. So I'm guessing the same thing will happen in USA. So let's find out what we gathered so far. We found out that 6 women were all white. One of them out of the 6 women were on oral contraceptives. 3 out of the 6 people were obese. About 5 out of the 6 people had headaches, and 4 out of 6 people had neurologic symptoms. What kind of neurologic symptoms? Like headache. Neurological deficits, like stroke-like symptoms. You may have facial weakness in one half of the face or any half part of your body. Those are the symptoms we need to think about. If blood clots happen in your chest, you can have shortness of breath and chest pain. If it occurs in any of your organs in your abdomen, you can have abdominal pain. If it occurs in your legs, you can have leg swelling and pain as well. So be careful. Remember, COVID-19 itself causes more blood clots. I'm also going to put in a picture here to show the differences between incidence of blood clots in general population in different medical conditions as well as for the J&J vaccine, and you will see how minimal it is. But we need to inform you of all the differences, right? All right, so what was the common criteria in these 6 women? They all had low platelets. It is thought that women have more immunologic response than men, and thus, because of probably reproductive care for us, the way we were made, women have better immunologic response. That's why COVID-19 affects worse in men than women. But in case of women, we are thinking there's an autoimmune process. What that triggers is an antibody formation against platelets and factor 4 that starts the thrombotic process. That means causes the blood clot. Our brain gets the oxygenated blood through the arteries, right? And it returns from the whole brain through the venous system, and that's where the blood clot is happening. It's in the venous system. So that's why we are calling it cerebral venous thrombosis. So we already talked about the different symptoms, right? So when should we be concerned? If you got the J&J vaccine, I'm sure you're worried about it. You're thinking, should I go to the hospital? Should I be worried? It depends on when you got it. If remember, it's 6 to 13 days. So if you are within that 2 weeks, then yes, it is a caution period. But after 2 weeks, it's probably just a mild precaution. And after 3 weeks, you don't have to worry about it anymore from what we have gathered. All right, so definitely you also think about J&J vaccine is just like Moderna and Pfizer for the other side effects. This is specific for the brain blood clots. All right, so one other thing about this blood clot, it is seen that heparin is contraindicated in this kind of thrombosis. It does more harm than good. So you should, any healthcare provider should treat it with other forms of anticoagulation. They can even give immunoglobulin. I'm not going to go into details about this because this video is for general population. Any questions you have, feel free to write it in the comment and I will try to address. If you like this video, don't forget to like and subscribe. If you don't like it, also put in a comment so I know and I can address that as well. So remember, America has Pfizer and Moderna, and it has enough vaccines so everybody can be vaccinated by end of May, maximum June. But remember, America cannot stand alone. The whole wide world needs to defeat COVID-19 together. Situation in Brazil, UK, and now India is not any better. If we cannot stop this virus from surviving, it will keep on mutating, and then the current vaccines may not work anymore. So the only way we can defeat this virus is getting the vaccination. CDC had released new information that shows out of 66 million people that were vaccinated, only 5,800 people had breakthrough reinfection. My guess is most of these patients already got exposure before they built their immunity. So the incidence is less than 0.008% of the total vaccinated population, which is minimal, almost none. So yes, vaccination works. So please, those who did not get the vaccine yet, please go ahead and get the Moderna, Pfizer. It has a lot of people are thinking that this J&J vaccine has been banned. No, it has been on a pause until we gather more information. Once we have more information, decision will be made and we will keep you posted. So get vaccinated. Let's fight against this virus together, and only together we can defeat this and get back our freedom. All right? More than 564,000 people has already died in America. We don't need any more death. So we can only do what we can do. Get vaccinated. Those who are contraindicated for the vaccine, there are antivirals that are in the process, and we're having good study results showing that just like Tamiflu, we should have some per oral medication soon that can also work against the virus. And yes, we probably will need to do booster shots every year, just like flu vaccine, and we kind of expected that. So this is not a shock. So let's get vaccinated. Let's defeat this monstrosity of a virus and get our life back. All right? Thank you for joining me. We'll see you next time. Take care.